gonna need to move that foot forward a step in just a second. There we go. Okay. Let's see if you can relax. All right, so let's get a little close up here. I'm gonna cut this ergot just a little bit so it's not in our way. So yeah, just a pretty extensive and severe case of thrush here. Not uncommon, unfortunately, with giraffes. Just really difficult to give them, you know, that extensive care because they're just so big. We're gonna start by just kind of getting the frog trimmed away. And once we expose the thrush, we'll do a treatment. And basically, this will kind of immediately provide some relief once we get the exfoliation trimmed away and once we get a good rinse going, and then we can medicate it. I have some vet wrap over here. We're gonna wrap it afterward too, so that it can hold its medicine inside it, and you can kind of start to get a little bit of a healing going on, sort of like a Band-Aid. It's good that we have some footage though, so we can see the extent to which he has the thrush, and we can kind of keep track of how it's progressing or healing. Hopefully we don't make him bleed, but this rotten frog does sometimes, you know, bleed a little bit as we're cleaning it away. The majority of his issue is right here in the back, so once we can get this cleaned away, he'll be having a little bit more relief, and I won't have to be cutting at the sensitive areas. Oh boy. Yeah, so this is like a pussy type of response from the thrush. This kind of like pit area, this little crater, is all what might seem to be, you know, I guess not that big a deal, but definitely does create sensitivity. So luckily it actually could definitely be the result or the culprit of his soreness, which is, it's actually kind of a good thing because we can get this taken care of. The central sulcus here is a little bit more of a sensitive area. The areas on top of the frog here, when they're thrushy, it's not as detrimental, but the architecture of the hoof flexes there in the middle. And so when the thrush is kind of permeating in this area here, see how I flinched a little bit there, a little bit more sensitive there. So we'll do our best to get that cleaned out real good, get it flushed with the rinse, and then we'll medicate it and then wrap it with a vet wrap. And just controlling the environment with a vet wrap will really help make some progress on it. These are such strong and big creatures. We don't really usually think that something like this would bug them that much, but once those kind of bacteria start to fester in these sensitive areas, you know, you go from maybe not be active to something like that, and then all of a sudden it's painful. I suspect he potentially has it in the other hind foot, and that's why he's kind of picking it up. He might have it in all four, we'll see.
I was thinking he had an abscess, so.
Yeah, I mean, these are actually, those little pus pockets as a result of the thrush are in their own way kind of an abscess in their own way. And so it sort of is similar. Basically, it's yeah, more or less nature's shedding mechanism or trimming mechanism as it decays and kind of wants to, you know, release itself if it can. So keeping these frogs manicured routinely will help, you know, prevent it from coming back and getting worse. But initially here we'll have to kind of just treat it like a wound, keep it clean and then wrapped. You'll notice, unfortunately, there's a little bit of blood there from when I cleaned out what's called the central sulcus, the cleft there. And so it's kind of indicating what I expected, which is actually, again, it's kind of good because we're not really wondering why he's sore. We know this is definitely, you know, something that would bug him. This ergot's pretty significant.
Yeah, he's got a big one.
Yeah, he does. Got a big everything.
They grow, yeah, they grow long. I've had experience on some horses have them, and some just, you know, grow and grow and grow.
Definitely part of the draft type of horses having a kind of a larger one. Okay, you know, luckily that's really not that bad. It's pretty close there. You need some other things done to the hoof, but I want to focus on this part right now. It's kind of what we're most concerned with. So let me just get a good rinse here, and I'm going to go to the other foot. We'll do some more trimming on the sole and the bars of the hoof in just a moment, but I want to give him a good rinse, let him get the signal that we're hopefully not going to hurt him, that he's going to get some treatment here, and that this will actually feel a little better. Good. I mean, we're already making some good progress there. So we'll give him back his foot, and we'll go to the next one. Before I wrap it, I'm going to cut a chunk of this off and stuff it on top of there so it kind of holds whatever I'm putting in there.
Can you show me what you're putting in there again?
Yeah, this is a copper sulfate powder.
Okay, cool.
There's lots of different types of treatments we could use. I have some clays or some medicated clays. There's also this type of liquid that we put in there, which I also will be using. Frankly, a little TLC goes a long way with this type of condition. Just keeping the area as clean as possible, and initially, wrapped or covered with a vet wrap or something like that, really goes a long way to help it kind of get under control and then heal. But definitely got to get that sorted. His ergot's a little bit in the way, so trim that a little bit. These horses also have a tendency to develop what's called scratches. There's a colloquial term, but it's more or less a type of irritation and rash under their skin and hair. So he has a pretty significant amount in the crease here of under his fetlock, and it's actually bleeding. So what we'll probably want to do is give that a good rinse as well. And then in the future, he might need a veterinarian's attention, maybe to sedate him. If not, he could potentially stand still for it, but he needs to have his hair trimmed or clipped away with the clippers. And right now he's trying to be cooperative, but he's certainly hesitant. He knows that there's some issues here. It's going to be potentially painful as I'm trimming it away, and he can't help but kind of pull away a little bit. But he's trying to do good here. That even had a little rock in there, so it's, like I said, kind of reasonable that this stuff would bug him. Trying to open it up while not cutting into too much sensitive stuff. The tissue gets a little bit decayed, and it can be kind of raw and a bit sensitive and tender, so do my best to clean it out, but not make him any more tender than he already is. Very normal, typical response. Just like, ouch. Good boy. Okay, don't want to make him stand here too much longer. I'm going to go ahead and get a good rinse on this one.
So what are you rinsing that with?
It's a mixture of, it's primarily copper sulfate mix. There's a couple of other ingredients, but it's basically just a kind of an antibacterial.
Does it work with scratches?
It's not really meant, it's a decent thing to spray initially on scratches. Scratches will benefit more from this oil, for example. It's a little bit more conditioning. It's also antifungal and antibacterial. It's got turpentine oil in it. This is more for something like a thrush. But yeah, he's definitely letting me know it's time to move on to the next foot, so we'll let that one be for a moment. And again, we'll come back, medicate it, wrap it with a vet wrap. All right, let's go ahead and come to a front foot and just see. I wouldn't be totally surprised if he kind of has a little bit of this going on in all 4 feet. Doesn't really seem too eager to stand on the left front, which kind of makes sense. It's got a little bit of a crack there. It's obviously kind of a flatter hoof capsule. Probably not ideal for being such a big guy, but there he goes. Okay, yeah, you can see how I can already get that pus to kind of come out of there.
Yep.
So it's indicating that he's got that thrush going on there. And it's a little bit different than the other side, or the backs rather. You'll notice that this area right here is actually relatively intact, but then kind of underneath it, under here, it's kind of undermined with the thrush. So yeah. Again, actually somewhat of a good sign, because we're not really going to be wondering what's bothering him. This is sort of obviously something that would bug him, so we can get this resolved and hopefully he can get back to feeling comfortable again. And again, doing my best to not make him bleed. Just want to get as much of this decayed tissue out of the way as possible so it's not continuing to trap anything in there. Got a little bit of thrush on the commissure here, which is the collateral grooves on the side of the frog. Down there. That works. Set it on the ground like that. All right, let's go ahead and give this one a good rinse. Move on to the other one. Same deal, a little bit of threshing is going on, but not too bad. And definitely mostly here again in this, what's called the central sulcus, or the cleft of the frog. So kind of just want to see how deep it is. So, you know, it's pretty well in there. So let's go ahead and get this trimmed up and then get it rinsed out, and then we'll go on with our treatment and wrapping. He needs a little bit of a trim. He's kind of got a little bit of excess sole left in place, but it's really not a priority at the moment. We want to go ahead and get this cleaned out, get it wrapped up, and let him have some relief, and we can manage to take care of that a little bit later on or another time. He's
another visit.
Yeah, he doesn't have a tremendous amount of excess hoof in place anyway, so it's certainly not what's you know, it's not what's ailing him, if you will.
Right.
And I can tell that you guys have been trying to help us, because I see the leftover purple from
Yes.
some type of thrush treatment. So
yeah, it gets treated every week.
yeah, it's kind of the nature of the beast with these bigger horses. They're really susceptible to this, unfortunately, but we can help them get over it though. Really, the main thing that we're going to do that's really going to help him is getting them wrapped up. Once we medicate them and then wrap them, just keeping him away from his own, you know, urine, manure, that kind of thing. That'll really help us get control over this. And it's actually a very resilient part of the anatomy. This part of his hoof kind of heals relatively quickly with a little bit of TLC like you guys are already doing, and then getting this excess frog trimmed out of the way so he can be treated better. Not really enjoying standing on that other foot, which is normal. He's being super cooperative. I like seeing him licking his lips right there. Kind of indicates a lot of times that's a bit of a relief. He's getting the message that, you know, it's helping. As usual, everyone's here to help. Cool. Just done a little bit of light rasping. He had a little bit of what kind of like protruding sole, so I just want to take that down just a little bit, but it's definitely not his concern at the moment. Started. You see the rinse is already doing some treating there, so that's good.
That's where the green is, right?
Yeah, that bluish turquoise look is the copper sulfate doing its thing, so it's already kind of helping out there. Squeeze some of this for extra measure. And then I'm going to sprinkle a little bit of copper sulfate powder on there. There's not necessarily a specific rhyme or reason to these types of situations. A little TLC goes a long way, so we're just trying to do our best. Like I said, most of the benefit's going to come from kind of controlling the environment and keeping it from immediately being exposed to manure, etc.
How do you feel about duct tape?
Yeah, we're gonna do a little duct tape layer afterwards. Absolutely. And that was just one roll, so he's definitely gonna take 2 rolls per hoof. So I'm gonna have to take a quick trip to a local store. There's bound to be some place nearby I can get something.
I don't think so.
No, huh? Okay.
May just have to be a second trip.
Gotcha. Well, we'll definitely get his back feet covered.
Yeah. We'll have to have a bucket per foot.
Exactly. It's okay, we'll get his number. Good deal. Okay, we're gonna call that all that good right there. Give it a little moment.
Here we go.
Thank you.